All right, and so we've discussed the allocation of these vaccine candidates, assuming they do eventually come to the market at scale. But remember, when you have a public health emergency of a global nature like this, who gets to own and who gets to profit from the proceeds of the research that's been put in, the money and the time and the effort used to develop these vaccines? Let's explore that in a bit of detail with Liz Lenjo. She's an advocate of the High Court here in Kenya, specializing in intellectual property law. Liz, this is going to be a bit like Law Class 101. So let's start with the basics. What sort of IP protections do apply in the world of vaccines, and does that change when you're talking about a public health emergency?
Okay. So when we're talking about intellectual property and protection in the pharmaceuticals and medicine sector, they're still entitled to general IP protection. So we're talking about patents, where these medicines and devices are entitled to patent protection. Remember, patents, we're talking about novelty and newness and industrial applicability. So the threshold is much higher. And the protection is up to 20 years exclusively to the patent holder. And then we're talking, in terms of also industrial designs, perhaps maybe some of the devices that in which the patent holder may be using to administer the medicine may also, gain that protection. They would want also to stand out in the market, right? So, there could be aspects of industrial designs as well for any devices attached to the medicine or just a medical device. And then, of course, trademarks, how you brand the name of the medicine or the vaccine as well, they would get that kind of protection.
Right. So we've dealt with public health emergencies before. HIV, for instance, cancer do come to mind. And Indian case law has a long history of taking the view that you can't provide patent protection and grant it in a country where average incomes, A, are pretty low, and market pricing would essentially deny access to healthcare for the vast majority of the population. Essentially, they're making the case here that the greater good needs to be balanced off against giving a return to investment and, of course, compensating investors for taking risk in developing that particular drug. So given the sheer scale of this pandemic, does that set a precedent that then several other African states which share Commonwealth law can then follow?
Okay, I think it's always important to highlight that we have some legislative developments on the international and local scale. In 1995, when the TRIPS agreement was passed, which is the trade-related aspects agreement on intellectual property rights, or rather trade-related aspects of IP agreement. They introduced the TRIPS flexibilities. Here we're talking about compulsory licensing when it comes to issues of access to medicine. Now this provision is catered for, is protected or provided for in issues or instances where we have such issues of medical emergencies. So in instance, we're talking about COVID-19 and the issue around the potential access to a vaccine. So, when a patent holder fails to grant a license to a third party requesting for this particular access to the patent, then they can plead for compulsory licensing through the government. So, all governments or other member states that are parties to the TRIPS have this provision in their law. So, for example, in Kenya, we have it in our Industrial Property Act under Section 80, which provides that where a patent holder fails to grant a patent, that is going to save a life, for example, then the government would grant such. But what this basically means is that the patent holder is not excluded from earning from his, from his patent. It just means that in this instance, they might not make as much as they would want. So, this is one of those flexibilities that also is a call to action for the pharmaceutical and medical medical inventors, that at the end of the day, they should, be also proactive and think about, just this whole market disparities and figure out, differential pricing, basically, in terms of access to the different countries, low income countries, high income countries. And then that way they are in control. So failure to control, then, we'll be looking at compulsory licensing, and in this instance, they will be compelled by a government to give access to the patents.
Right. One last question for you. Given, obviously, the scale of this crisis, funding from vaccine development has come from all sorts of places. Perhaps one of the more interesting ones was, I think, a 1 million donation from Dolly Parton, the country music artist, to Moderna's work on its vaccine candidate. So given this massive mosaic of different sources of funding. Do any of those funders get a slice of the IP rights and any net earnings from the end product? Or is it that given this is a public health emergency, sorry, you guys are just going to have to deal with taking a very tiny slice of earnings somewhere out in the future?
Well, Rama, at the end of the day, this is a contractual agreement between the two parties, between the investor and those seeking the investments. So it will vary at the end of the day. There is nothing that legislates what an investor would seek in such an instance. But I think it's always great to understand that there will be the philanthropists who just are keen on social impact investments. They're looking at the impact more than the investment. And then there'll be the investors who are, mainstream investors and always looking at profit. So at the end of the day, it will vary, and the kind of contractual agreements that they would have between themselves and those they are funding or investing into.
All right, we'll leave it there for the time being. Liz Lenjo, thank you very much.